Well, hello, DMV. Your girl Jackie Paige here. And as you can see, we are in another edition of Girl Talk Live. We have been talking about a lot of issues pertaining to women, things on the inside, things on the outside, things that we deal with on a day in and day out basis. And that will be the same today. Today, we're going to talk about domestic violence because it is alive and it is real in Prince George's County. We're going to talk about who's at risk, how do you recognize if it's happening in your relationship, and how do you get help. 1 in 4 women and 1 in 4 men have been victims of severe physical violence by an intimate partner in their lifetime. That means that somebody that you know, somebody that may be very well close to you, has been abused or will be abused. October is Domestic Violence Awareness Month. So we want to make sure that we know the signs, we know what to look for, and that we are being aware. I cannot have this conversation by myself. So I'm so excited to have with me Dr. Donna Melynda Clarke. How are you doing today?
I'm doing fabulous, Jackie. Thank you for having me.
More than welcome. Thank you for joining. You have a wealth of knowledge. Let's see, you are LCPC NCC Program Manager for University of Maryland Capital Region Health, Domestic Violence, and Sexual Assault Center. So you know your stuff.
I know a few things, but I do have a wonderful team that I work with, and that's what makes it so exciting is that we are so well-rounded at our center.
Yeah, and that's why, like I said, I wanted to have you sit down with me and the viewers today to talk about domestic violence because it is something that is real. It's happening, and we need to address it. We got to talk about it. We got to know these signs so that we can prevent this type of stuff from happening. 1 in 4 women have been victims of severe physical violence by an intimate partner. That's a really big number when you sit down and you start looking at the numbers. What exactly is domestic violence or intimate partner violence?
Sure. We hear that word or that term, that phrase a lot, and it's really a pattern of coercive behaviors. It's a pattern that we see where victims are being controlled by a current or former partner in some way. It can be dating violence. It can be some kind of dating relationship where it's the intimacy. Sometimes people judge it differently, but usually it's romantic in nature, some type of relationship. And those behaviors, they cause physical harm, fear, some type of control. It's very interesting because it is not just physical. It
Mhm.
is.
Can you elaborate on that a little bit more? Because a lot of people think like, oh, harm means physical, but it may not always be physical.
Absolutely. No, it's we acknowledge always the victimization that people have when it's physical. When we see something, marks and scars and injuries and things of that nature, and certainly that is very concerning as well. But it's not limited to that. Many times it includes emotional abuse, taunting, verbal abuse behavior, threats of harm. It can be psychological. It could be sexual manipulation. It could be control in terms of medication, healthcare, finances, your bank accounts, your passports. There's so many ways that this can happen to a person, and it still falls under that umbrella of domestic violence.
Wow. So, all of my girlfriends, most of them, if not all of them, are in relationships.
Mm.
And we talk about that number, 1 in 4. I look at my best friends, I look at my girlfriends, like they're all strong, they're all, independent, they're doing
Mhm.
their own thing. Um, you know, could they themselves be victim? Like, would this be something that they would allow to happen to themselves, considering that they're doing so well and that they are, independent and strong?
I'm so glad you asked that. I really am, because so many times you hear about these incidents that occur, and people say, "Oh, I couldn't imagine that this person was like that they were in an abusive relationship. They look like the perfect couple." And that's the thing about domestic violence is that, abusers can be incredibly charismatic. They can be also very skillfully manipulative. And persons of any race or ethnicity or age or sexual orientation can be a victim. It really does not fall into one type of profile of who is a victim of domestic violence. The majority of victims are female, we know that, but it's not limited to that. And there are certain groups actually that are at higher risk. Women who are childbearing years or generally do tend to be a higher risk. People with disabilities, people who are vulnerable in other ways. And what really is alarming is the number of adolescents. We're finding that they are now a much higher risk for domestic violence.
When you say adolescence, like what age are you talking about? Because I think super young. So
Yeah, yeah, I'm talking teens. I'm talking teens, young adults, mainly teens, but yes, we're talking about college age students. And again, I would like to make sure that people who hear this are very aware that, sexual violence is very much integrated into domestic violence. So that manipulation that occurs with an abuser many times can bleed over into an act of rape or sexual assault as well.
mm,
And so a lot of people don't even think of it that way. They consider it to be a separate type of victimization, a separate type of trauma, but really and truly we're seeing more and more of it at a very heightened level and happening at the same time.
you mentioned that people in relationships can still experience a rape, and a lot of people are like they think I'm in a relationship. This isn't technically rape because this is the person that I am with. Um, Rape can happen in a relationship, correct?
Absolutely. And watch this. This is the thing that we live in a culture and a society that promotes exploitation, sexual exploitation. It has always been that way. Women have been, that gratification of sexualizing women and females globally. That's just the way it's been. But in our society, if you look at marketing, all kinds of things, you'll see it. You'll see it. So when people are in relationships, there's this expectation or this assumption that if you wear certain clothes or if you do certain things, then you are apparently okay with it.
Mhm.
But the reality is, and this is what we try to educate the public about with our community outreach, and especially young males, understand what rape is. And if you don't get consent, it is not, and you have a sexual act with someone, that is rape. You can be convicted of a crime. And so many people need to understand the fact that it has to be consensual. It has to be, you have to check in with a person, make sure they're okay with what is happening. And if they're not, we're looking at a crime.
Yeah. And I wanted to make sure that I had you point that out because, like I said, a lot of times people kind of sit relationships and they're like, I'm in a relationship. This is my boyfriend. This is my girlfriend. And it's not rape. It's just, an experience that me and my boyfriend or girlfriend had. But it can very well be rape if it's not consensual. So,
Yeah. Let me add a little bit to that too. A lot of times people, again, on this whole conversation of domestic violence and intimate partner violence. And so we know that someone might be intimate with somebody, but they may not necessarily want to do certain types of intimacy as well. So there comes this point where they say, look, I'm good. This is as far as we go. And the other person continues and pursues and forces them upon it. There's times when people want to force with intercourse without a condom. We get all types of people who come to us who are just it's just exasperating to see people who have been traumatized in such a way and feel this level of guilt because the people around them don't sympathize with them in this situation because they don't understand what rape is, what sexual assault is.
yeah. A lot of times when we think about domestic violence, to your point, we think of it usually as like a man abusing a woman, but it could be vice versa. So, what does
Yeah.
an abuser look like? What are some of the signs of an abuser? Because it's not just men, it's women as well.
Right. Unfortunately, we're seeing more and more incidents with women who are the abusers. There are men who come in and they are certainly not just emotionally abused, but and psychologically, but they are physically abused. We've seen some pretty horrific physical abuse by women as well. We don't want to leave out the LGBTQ
Yeah.
plus um, population. And I think the more that we see certain groups who are victimized in certain ways, or they find themselves misunderstood, or people are less empathetic, or people are less inclusive. It just magnifies when we're looking at victimization of some sort.
Yeah.
Um, and so, I mean, what does it look like, or who are these abusers? I mean, there's so many ways to look at this. You know, first of all, we know that I could look at signs of abuse and say, okay, someone who is extremely attentive, and we might think, oh, this guy is wonderful. He buys her flowers all the time. He's so attentive. He's always checking on her. He always wants to know what's going on. What do you need? Anything? But behind the scenes is really about control. And so, for some people on the outside, they don't really understand that there's more to it, that manipulation and control that's involved. Uh, I think also when we think about what are the signs, um, you kind of know when someone has to check in. They have to check to see if it's okay. Am I allowed? These are adults. These are people who have lives. But if they're unfortunately to a point where they cannot make decisions on their own, they don't have control of their finances, they're fearful about what could happen if they do certain things. So, just the old school kind of belief system that, well, if they don't show any marks or scars or things like that, that's not necessarily going to give you an indication that someone is in an abusive relationship. It could be so many other things
Yeah.
going on.
Yeah. Why do abusers abuse? I mean, is it like anger management? Like, do they have an anger issue? Is it something that happened in the past? Like, what do you typically see as like the reason why this happens?
Um, most people will say, well, first of all, it is a feeling of need for control, because that's what domestic violence is. It's about a person really wanting to control somebody
Mhm.
else. But they don't necessarily have that same behavior with other people, which is kind of interesting. But what we do know is that their early history, sometimes they have been themselves raised in an abusive environment, and they have seen this and they have normalized what relationships look like. And so they expect that this is okay, that they can be cruel and have hardened language and those types of things with somebody. But in addition to that, in many cases, people who are abusers, they don't even know how. They lack empathy. They lack accountability. They don't understand what it means to feel what that other person is feeling themselves. And so they've gotten this kind of hardened shell about them. It's not anger necessarily, it's just their way of processing emotions. Some of them may have mental health conditions. Some may have some other dysfunctions because of previous trauma that they have not addressed. And so that trauma comes out in terms of projecting those fears and that frustration and that anger, as you mentioned, that might be somewhere entangled in there. But it's a dysfunction of being able to communicate. It really is. It's an inability to be able to communicate in other ways. And so they use their own method of control. Sometimes it's even just simple inability to feel self-esteem,
Yeah.
high self-esteem for themselves. And they feel that they need this to feel important.
Now, this may be a far off question. I don't know. Do abusers know that they're abusers? Because sometimes I feel like we're really good at like seeking out everybody else's problems and telling everybody else what their issues are, but when it comes to us, we don't always see like what our issues are. So, do abusers know that they're really abusers, or do they just think like, oh, it's something else going on? Like, do they not see it?
No, I think it's probably a little bit of both. I think they know, most people would know that there's maybe some things that's going on with them, but they're not necessarily going to admit it. They're
Mhm.
not going to accept it. It is an educational kind of process they have to go through. There is counseling that needs to be done. There's ways that they have to process what it is that causes them to feel a certain way and treat people a certain way. And so, yeah, it's they're aware that it might be harmful to a person, but to acknowledge the consequences to that individual or to the family that's involved, um, that person may not really process it the same. And I do believe it takes a lot of intervention. Our programs that we have here at University of Maryland are specifically victim centered. So we do not have a specific program for abusers. There's separate organizations and agencies that specialize just in that, because that's just a separate component of it in itself. House of Ruth does a great job, and certainly there are many others as well.
Yeah. Can you talk about some of the programs that you have? If anybody's watching right now and they something you said a second ago just like sparked within them, like, hey, you know what type of programs do you guys have?
Here at University of Maryland, we do have a wonderful comprehensive center. When we are the Rape Crisis Center for this jurisdiction, so for Prince George's County residents and guests who have been victimized here in the county, or those who may be here and for whatever reason they are unable to get the sexual assault forensic exam at another location where it occurred, we are the Rape Crisis Center that does those exams. And we also do what's called a strangulation exam here. We have registered nurses who are certified forensic nurse examiners, and they are specially trained specifically for evidence collection. And these are kits that are put together specifically to collect evidence in case there is a plan to prosecute.
Okay.
But of course, we are a trauma center as well, very busy one. And so the traumas that we see, we are certainly there to provide that medical attention. But then we also have um, professional counseling, and we are able to provide that trauma informed counseling as well. We have community education. We have an amazing advocacy program. We have these crisis counselors and case managers here who rock. They are able to really work with our clients in a way to help them heal. And so after all the trauma is over, and many of them are survivors from traumas years ago. Some of them are survivors from their childhood even, but they still have that residual effects of trauma, and they're still trying to get on their feet, and they're still trying to stay in a stable environment. And so we do that. We also accompany them to court, to medical proceedings. We provide workshops on financial literacy. We help with navigating them through housing and community development for their subsidized housing program. We've been able to do some wonderful things through our advocacy program. And then the community education, as I was mentioning, will come out. Of course, COVID has changed a lot of things with
Yeah.
that, but we have been very active in the community doing all types of workshops and educational services for anything from bystander intervention to providing information on the law. Remember what I was telling you about, educating our young men about what is rape, and and helping them to understand that, and healthy relationships, helping them to really understand what it means to be in a strong, healthy relationship, a romantic relationship with someone. So yeah, we are very proud of our program here, but we're very busy. But we have volunteers too. Anybody who wants to volunteer with our program, they can apply through the hospital, and we have a wonderful volunteer corps as well.
Are there any qualifications or any like certain requirements that a volunteer needs to have?
Well, of course, you have to meet the hospital requirements for
Okay.
volunteering. And so I think that's probably one of the first things we'd have to make sure everybody's aware of, is that we're in an environment now where we have to make sure people are vaccinated. The hospital, like many other healthcare providers, required the flu vaccine before, but since COVID and now the Delta variant, we are all being required to get the um, COVID vaccine. Volunteers, I'm almost positive there's probably some very close requirements as well. So there are certain things they'd have to go through. As far as education and things like that, I don't think there's any major requirements, but I would say age requirement, we would prefer people 21 and older. Certainly those who are mature enough to handle this kind of work.
You mentioned the pandemic, and I've seen like a few articles and heard a few stories of like relationships and domestic violence increasing because of the pandemic. Is that something that you all experience, an increase in cases and clients coming in during the pandemic?
That's interesting because we actually, when the pandemic first started, we noticed a decline in calls. We really did. And most agencies did. We really weren't sure what was going on. We started to speculate, well, maybe because people are kind of trapped in their homes, they can't make the phone call. They can't escape, what's happening inside the home. This was really the case across the board, even with child abuse agencies. There's a lot. We've been working with a child advocacy center, and they said the same thing. They were concerned because kids weren't in school, kids
Mm-hmm.
can't report, and so I think there was some concern at the very beginning. And two, people were not quite sure whether people were open. They weren't. Well, are these agencies still
Yeah.
answering the phone? Is there anybody there?
Mm-hmm.
So we found that we started putting more information out there and trying to get word of mouth and social media and whatever we could to make sure people were aware that these services were there. And it began to pick up again. And then finally, I guess around the fall is when we really started to see an uptick in numbers. And now it is really high. It is really high. I think what's happening is that people are just have been inside, traumatized so much. We know that 2020 was a traumatic year in so many ways.
Yes.
And we know that all of those things put together has put everybody on edge as far as high anxiety, depression, and then all those other factors added to it probably did increase the amount of abuse cases that were occurring, but whether they were reported or not, that's
Mhm.
hard to tell right now. There's probably studies that'll be done for years to try to figure that out.
This is a random question. If Is there a certain amount of times that the abuse has to happen before it's considered abuse? Because you know, in my and I'm gonna be completely honest with me, I like things to happen a few times more than once before I actually like classify it. I'm like, let's give it another try before I say I do or I don't like this. And I'm sure a lot of other people are the same way. So, they may have been abused one time and they felt like they felt like it was abuse, but because it just happened that one time and it hasn't happened again, they haven't classified it as abuse. So is there like a number of times that it has to happen before you can say like, hey, this is abuse?
Well, you might get different answers to this one, but I'm going to say no, there is no specific number. There's no minimum number. I know for a fact that there have been cases where people there have been lethal cases of domestic violence with when the reports come in and they say what happened, this individual lost their life, that yet there were no other reported incidents of abuse. There was nothing else that led them to believe that this was a person that was abusive. And so I think there's a number of reasons for that. One of the reasons is that some people would classify abuse as abuse, others wouldn't. And a lot of times the physical abuse, not always, but sometimes the physical abuse comes after there's been a history of, the emotional, verbal abuse or other kinds of manipulation or control. Very subtle, may not even be considered abusive to some people, but yet now something happens and the person explodes. Something happens and this person loses control, or maybe um, again, you have abusers who may have some underlying mental health conditions, or maybe they have struggled with alcohol or substance abuse, and now it's starting to get even more critical. We just don't know. And so I would be very cautious of putting a number on it. I know there's a pattern. The pattern is what we use to define domestic violence, because that is truly the understanding of what it is. But there's always the exception to the rule. And we want to make sure that people are fully aware that those flags, those signs, anything, and just being able to communicate in a way that someone can say, look, I really, I need some help. This is starting to bother me now, versus someone who does it and ignores it and says, oh, I'm sorry, let's get over it and move on. And then it just keeps escalating. And next time it happens might be the third time, and that might be the time the victim's in the hospital.
Mhm. Um, Can you report a domestic violence situation or an abuse situation confidentially? Because I feel like that may be one of the reasons why a lot of people don't speak up and say anything is because they're afraid, like, hey, if I say something, like my abuser is going to hear about this and it's just going to make the situation worse. So, is it one of those things that I can come to you and say, like, hey, this has been going on, just to create that history and that pattern?
I think you should encourage people. We should all encourage people to have someone they can talk to who they can, somebody they can confide in. If you go to the police or something, they're really not going to do a lot with that unless you're trying to report
Mhm.
something to them. But a friend, a family member, someone, a coworker, anyone that you can say, look, I need you to understand what I'm going through for a minute, because I need to check in with somebody, just so that they can help the person be able to gauge, hey, this happened to you last week.
Mhm.
Well, you just told me such and such happened a couple of weeks ago. Because a lot of times victims, they'll forget that they had that conversation just a couple of weeks ago, you know? And again, it's normalized in their eyes. They're starting to feel as though this is just the way it is without recognizing there's something going on here. Having that objective view is really so beneficial,
Yeah.
so beneficial.
And if you're watching right now, it doesn't have to be to the police. Start off with, like Dr. Clark said, a friend, a family
Mhm.
member, just somebody that you can talk to, so that you can start to establish like a history. And we ourselves, we like to have blinders on and we can't see. And the people on the outside typically see a lot better of what's going on with us than we do.
Mhm.
So, it doesn't necessarily have to be the police. It doesn't have to be a hospital. You can go to people that are close to you and have those conversations, and have those conversations. You need to have them. They're so important,
Yes.
because again, we put our blinders on and we don't see what other people see and what's going on.
Yeah. And Jackie, that's key too. If we're receiving the information, someone comes to me, comes to you, starts confiding in you, the important thing is not to judge, not to say, why don't you just get out? Why don't you just leave? I wouldn't put up with that. I wouldn't do that. See, those are the things that are not going to help this person. First of all, leaving is usually the most lethal time for someone in an abusive relationship. That they've been going through a lot of abuse, particularly once they make that decision, they get that protective order, they decide they're going to leave, it's going to it make it even more intense at that point. So what we want to do is to ensure that we help them come up with a plan to help them kind of figure out, okay, where am I going to go? Where are my documents? How do my children know that we're going to transition to something else? What is a safe places I can be? Help them work through that. Listening. I always encourage people, before we say anything, make sure we're listening, being empathetic about what is happening with this, with your loved one, with your friend, your family member. We cannot say we understand what they've been through,
Mhm.
but we do know that, as you said, 1 in 4 women have been through this. And so sometimes when people hear it, they associate it with their own experience and say, well, this is what I did. This is what you should do. But we have to be very careful that we don't begin to make it our story.
Mhm.
Just recognize that, yeah, yeah, it's about them at this moment, and
Mhm.
be able to listen and not judge. That's why a lot of women do not leave, is because it's so complicated, it's so hard that many times the abuser has the upper hand, and trying to leave and start fresh and ending up in a shelter and not knowing how your kids are going to get to school and not having the financial wherewithal, it's more than a notion. It
Yeah,
really
and
is.
those are things that I'm sure the same way we think about, the same way we think about those things, or the same way that somebody that's being abused, they're thinking about it too. And that's, like you said, one of the reasons why they're like, hey, you know what? I can't leave. Like, I don't know what my tomorrow is going to look like if I'm not in this house. I don't know what's going to happen to my children if I'm not in this house. So they, being, and we as women, we're caregivers. We always give ourselves, we're always thinking about everybody else and not ourselves. And, thinking about everybody else is one of the reasons why we don't move, is
Right,
because there's
right.
other things going on in the particular situation where we can't get out. Um, if somebody is watching right now and they are in an abusive situation and they want to get out, what are some of the things that they can do to get out?
Well, there certainly they should know that there's a commissioner that they can go to. If they're listening in the Maryland, state of Maryland, there's a commissioner in particular Prince George's County where they can get a protective order 24/7. They should be able to get a judge to issue a temporary one. And that way they're able to at least have the person served. The police will be there to assist. If you want to leave and you just want to keep this person from continuing to harm you, you can get that done. A lot of people say that's a piece of paper, but it's a first step if you are ready to make that move. I would suggest talking to some of the domestic violence agencies in your area. I know this program is going to be seen by so many people, so I can't say any particular jurisdiction, but certainly DC, Maryland, Virginia, all of them. If you even just Google domestic violence, you'll pull up a number of agencies and you can talk to a counselor and an advocate who can walk you through that. Getting out means that, like I said, it is a plan normally. You don't want to wait until everything is just given up, but you also don't want to wait until someone is really harmed either. So you know that if you need to start making that move, start putting together the plan of how you can pull your documentation together, how you can get your clothes and things together. Where are you going to go? Where are your children going to go? Where's your pet going to go? Where's your elderly parent going to go? I mean, all these things, and have a talk with someone at one of those agencies and they'll walk you through. Everybody's situation is different, it's not the same.
Yeah.
So it does get a little complicated, but you can do it. You can
Yeah.
do it. I tell you, I've seen people start over and their lives have changed, and they don't have to go through that. They can heal.
Yeah, and sometimes you just need somebody there in your corner, to help you and to push you and guide you, and kind of to your point. Like that's what Dr. Clark is here to do, is to help you and push you and guide you so that you don't have to sit in this situation. You can get help, and you can get out. You mentioned kids a few seconds ago.
Yeah.
The reality is a lot of abuse situations have kids involved. How does domestic abuse impact kids?
Oh, it's a terrible way for children to grow up. They are experiencing sometimes the abuse themselves, but not always. We have to remember that just witnessing it is a traumatic event for them, seeing a loved one being hit or being yelled at or constantly being taunted or tormented or threatened, the pet being threatened, all of those things affect a child's psychic. Now, what does that mean? That means that it affects their learning, their studies. ACE studies show these children tend not to learn as well. They don't do as well as in school. Their social skills are hindered because they are now learning a behavior pattern, a way to retaliate or to respond when something doesn't go their way. Later on, these same children, studies have found that they are higher risk for all types of comorbidities, for anything from uh, alcohol and drug abuse to things like high blood pressure. I mean, it's hardwired into our DNA at some point where our stress levels and the toxins in our body literally begin to go through a process, PTSD. And we are at a point where, as children, we grow up into that environment. It can damage our learning, damage our brain function, damage our growth, and children can grow into the same behavior as well. Not always, but sometimes they will all They will normalize what they see and see
Yeah.
this is, oh, this is where a relationship is supposed to look.
Yeah. How often do you see where there's an adult there's an adult being an abuse, there's an adult being abused, and a child in the household is being abused as well? Does that happen very often, or is it usually just like the mom and no child involved, or do you see a lot of cases where it's like mom and child or dad and child?
I can't say we see cases where they report the child as being abused as well, but we know that the child is in an abusive environment, and technically, we are required, if that child is witnessing that abuse at that time
Mhm.
when a person comes in, we are required to report that to Child Protective Services. Now, it's not intended to separate the family from the child or anything like that. It's to provide them resources so that the child can be in a safer environment, because we don't know what could escalate later on. But again, it is impacting that child. It's definitely impacting the child's growth and emotional development. And so we know that it's important to ensure that they are provided some means of getting out of those kinds of situations. So it's very disturbing, when you do see children. I will say this, and I won't say this is the norm or it's going to happen, but I will say this, and this is a caution, that many times if a person is in an abusive situation and children are involved, they're putting themselves in between the abuser and the child.
Mhm.
And so that's what we're seeing a lot of times. We also, and I don't have the statistics on this, and my colleague who is our DV coordinator probably does, but we do know there is evidence that many young boys who are incarcerated today are in jail because of what they did to protect their mother from
Wow.
an abuser. So they have, literally either shot the person or did some tremendous harm to that individual because enough was enough and they were stepping in between their mother and the abuser.
And that's a piece I didn't even think about. Now that you bring it up, I mean, I've seen, situations on TV where that's happened, but now that you make that point, I mean that like you said, that's quite insane that, you have grown men and women in jail right now because they were trying to help a situation
Yes,
that was going south.
yeah.
Crazy.
It is crazy. Even women are in jail for that same reason. And now their children are in foster care or some other place because this situation occurred. And it's very tragic. It
Yeah.
really is.
Yeah, for the whole entire family, for everybody involved. How do I know if somebody around me is being abused? What are some of the signs that I can look out for?
Well, I tell you, the signs, let's see, here's a good one. Someone who's super jealous, constantly controlling or angry, keeping track of everything a person is doing. Someone who is very critical, highly critical, demeaning, talks about someone, you're worthless, you're this or that, or never gets anything right, can't cook, you don't do this. I mean, it's just a number of things that are signs that make you wonder, wow, that's a terrible way to treat someone.
Mhm.
But the jealousy piece, I think, is a big marker, and I think it's definitely a flag when someone has a very quick temper or concerned about someone just being with someone, just having a phone call, checking text messages, things like that.
How can I tell if a friend is being like? How can I tell who the abusee is? I don't know if that's a word, but how can I tell if like a friend is being abused?
Yeah, you know, I'll add a little twist to that. There's sometimes that the abuse can go back and forth, where a couple have become so confrontational, the conflict has become so intense that it is hard to figure out who's the dominant one.
Mhm.
So we have had to really step back and try to determine this by educating each one. Okay, have you considered this, that, and the other? And usually it comes out who is doing what. Because a
Mhm.
lot of times people will react in a way that they have to protect themselves, or they feel as though they have to protect themselves. And so they'll lash back out. Or maybe it's just over time they become angry, and um, their ways of managing their emotions are difficult. So it does sometimes it is very difficult to figure out who is the abusive person. But I would say most of the time you can figure it out. You'll know, Jackie. You'll know.
Yeah.
You'll be able to spot something is not right, the feeling's not right, if you're around that person enough and they're open enough to be transparent with you about what's going on. But you always have those folks who their life is like a secret and they just don't tell. And there are pastors out there who have been abusive. You have doctors and coaches and people who are model citizens who would you just would not believe that would do that. So that's why the person, you said it yourself, have someone that they can talk to, that they can confide in, having that friend. If someone is isolated a lot, that's a concern.
Mhm. Is it ever okay to ask somebody if they're being abused or if they are abusing somebody? I know we spent some time talking about letting the person come to you and have that conversation with you, but if
Mhm.
you notice some of these signs, and
Mhm.
they're just like not coming out and saying it, is it okay to be like, hey, you know what? Have you been abused? Are you abusing the person that you're with? Like, is that an is that a okay thing to do?
It's okay. I mean, your relationship with that person. It's okay to say, "Are you okay? Are you okay? I'm getting a little concerned about you, and I notice X, Y, and Z, and I really want to make sure. I want to check in with you to see if there's anything I can do to help you." And sometimes that person, when they hear that you're trying to help them, that person might say, I don't need your help, or I'm okay. But then in the same token, you planted a seed.
Mhm.
You told them, that there is someone they can talk to. You leave them with that information. You let them know you can reach me day or night, and then follow up, because the first time you ask the question doesn't mean that they're going to answer truthfully. They probably won't, not unless they're really in dire straits. Um, I would say definitely be aggressive, be assertive about asking someone, especially if you know them and you feel something's going on, have a conversation with them. And they may say, well, I'm okay with it. I don't mind that they do this, that, and the other. You have the opportunity to educate them, teach them, hey, okay, you may be okay with it, but how's it affecting your children?
Yeah.
How's it affecting your health? How's it affect? Give them other perspectives that they may not have thought of before.
You talked about that follow up. Is there a certain, because I know some people, hey, are you being abused? Hey, you got this going on. And people get defensive. They start lashing out at you.
Mhm.
And a lot of people are just like, I did my part. I asked. I'm about to just let this
Yeah.
go. Is there a certain amount of, follow up that you need to do before you just take your hands off the situation? Or, what would be your advice in that particular situation where somebody has a friend, that person looks like they're being abused. A friend asks, the person's like, no, I'm not. They get really defensive, but the friend is really concerned. So, what would be your advice as far as like that follow up process?
Yeah, I would say, hey, I don't want to be a pain, but here's some material. Here's a phone number. Here's something else. Maybe, a lot of times people don't like you in their business, right?
Mhm.
Right? They don't want you to know. So, hey, I'm gonna let it go, but look, at least take the phone number of this agency or that. So do your research. Have some options for them, some resources for them that they can go to, and that way, when you back away,
Mhm.
you're saying, okay, I did leave them with something. I kept them
Yeah.
in touch with an agency. We have this really cute thing we call a shoe card, and it's a fold up piece of about the size of a business card, but it folds up. And what it does is it has a list of all the different agencies in the area, but it also gives you flags, things to think about, ways to start your plan, your safety plan, and phone numbers, so that that person, and they can hide it. It's not in a plain sight of
Mhm.
the abuser too. So we would be happy to provide that to them, to someone who comes and may want to, pick up maybe a
Yeah.
few just to pass on to a friend.
Is it okay for a friend or a family member to report that somebody around them or somebody that they know is being abused? Or does it have to be the person that's being abused?
It doesn't have to be the person that's being abused. Just remember that it's a risk.
Mhm.
If a person is being abused by someone who feels threatened, they say that law enforcement, some of the most dangerous times for law enforcement is to come to a house for a domestic incident
Mhm.
or a traffic stop. And so we know for sure that there's definitely risk involved. Once you take it to that level, and that's why if they have some options, but if to leave and maybe have the person, take a weekend or something, if they can get them away for a few, then they can have that person be able to validate it. Law enforcement has really come a long way, though, with domestic violence. I would say that they have become far more um, trauma informed.
Mhm.
So they're much more aware now of the signs that don't necessarily mean that, oh, this person is just it's just a domestic argument, but they're also recognizing some of the flags. They know how to do a lethality assessment, which is actually came out of law enforcement. We use it here at the hospital. Many agencies use it as a way to gauge the lethality of the relationship, ask questions about whether the person has a weapon in the home, things like that. So it's really good to know that when you're picking up the phone and you're making that phone call, that there might be some reaction or
Yeah.
response that you got to be prepared for.
Yeah.
Um, the agencies that we work with that work with this kind of situation, sometimes we tell people, if it's getting too intense, call 911, call the law enforcement. Don't waste time, don't take chances. um, if someone else calls, they're going to want to know specifically what it is that they're why do you feel that you need the police to come out.
Mhm.
Have your homework done. Make sure you're not just saying, well, I don't like the way he looked at her and he pulled her arm. Give them something tangible if you
Yeah.
have it, just so that at least the officers will know what they're dealing with.
Yeah. So they have, like you said, so they have something to go off of
Yeah,
because everybody gets a crazy look from time to time. It's
right.
life. But we want to make sure that, when we are reporting for other people that, it's serious and that we really do feel some concern going on. And we're just not, like you said, playing around with, oh, he looked at her crazy.
Right,
People
right.
look at people crazy every single day. You mentioned some of the resources that are available for people that are being abused. Do you have any others that you can give to the viewers watching right now?
I'm just going to give you our phone number. Our phone number is 240-677-2337. We're the Domestic Violence and Sexual Assault Center here at University of Maryland, Capital Region Medical Center. You can certainly call us at any time, day or night, 24/7. We have counselors who answer the phone. And they can certainly steer you to any of the jurisdictions around us, rape crisis centers, places where you might need services in DC and Virginia. So we certainly are here to help you.
Yes, here to help 24/7. And I'm so happy that you said that because that was going to be my next question. I'm like, can people call 24/7? But you answered it. So whenever, wherever you can make the phone call, you can get some resources, you can get some help. And if you are trying to get out, you have people here that are willing and ready to help you make that move if that is something that you are ready to do. You got to be ready to do it because if you're not, then there could be some other situations that happen. So just make sure, like Dr. Clarke said, you have a plan. and that you're ready to walk that plan out. Dr. Clarke, thank you so much for taking, just a few seconds out of your day to talk with me and the DMV about this so serious topic. October is Domestic Violence Month, and we just want to make sure that people are aware, that people know the signs to look out for, not only within themselves, but also with the people around them. Like you said, 2020, 2021, they've been very interesting years. So we just want to make sure that everybody is living a happy, healthy, and joyous life. So thank you so much.
Thank you for having me and being aware that this is a topic we need to talk more and more and more about. Thank you
Yes,
so much.
you are more than welcome. DMV, thank you so much for tuning in. It's been another episode of Girl Talk Live.